So today we're going to talk about back pain and sacroiliac joint pain and distinguish between the two types of pain and what causes them. And these we're going to talk about types of pain that we'll call them non-surgical back pain. In other words, there's no question that should not be surgery for this type of a back pain. So oftentimes what will happen is the vertebrae will rotate out of position, press on the nerve, or stretch the nerve and cause back pain or dysfunction to wherever that nerve is going. If it happens to be the sciatic nerve, it might cause numbness or pain going down the back of the leg. So this is what the vertebrae look like. And when these vertebrae twist or get out of position, the nerve roots come out from these holes in the side of the vertebrae. When the vertebrae twists or gets out of position, it can press on that nerve root and cause back pain or sciatic pain. So what the chiropractor does is he figures out which vertebrae are misaligned and just puts them back in their proper position so you're not getting nerve pressure anymore. That's really why chiropractors are so famous for fixing back pain. It's their expertise. Another type of pain is called sacroiliac pain. This is a sacroiliac joint. It is a ligamentous joint. In other words, it's not held together by any muscles. It's held together strictly by ligaments. And they go in an X fashion. So some of the ligaments go this way, some of them go this way. When this hip gets misaligned, let's turn around to the front. When a hip gets misaligned, let's say it goes like this. Well, you can see the femur head, which is stuck right in here, this is called the acetabular cavity. When the femur head, which is stuck in the acetabular cavity, goes up or north as it has to do, it'll pull the leg up with it, making it appear that you have a short leg. So in this case, if this hip went like this, the right leg would appear short. It's not really short, but it just appears short because it's pulled up, so you would walk leaning more on one side. Well, if you're leaning more on one side, then the spine is going to tilt in that direction and you're going to be in this position. However, the body will adapt and will do this. And when it does that, it creates subluxations or misalignments in other parts of the spine. So we don't want that to happen. So what your chiropractor does is he always measures the length of your legs. He's always checking your leg length because he wants to know, are these hips balanced? The hips aren't balanced and it's tilting like this, then the spine is going to tilt off to the side. In addition, when this hip goes out of position, it pulls on some of the ligaments, stretching them. They get inflamed and it starts to hurt. And that's why when you touch the bone at the top of the butt, you'll feel some tenderness or pain, or if you feel it along this joint here, that's the underlying inflammation that's going on in that sacroiliac joint, just from the ligaments being stretched and pulled. So what the chiropractor is going to do is he's going to see that this hip has gone like that. He's going to make an adjustment, and many different ways to do it. Sometimes a little activator gun, sometimes with his hands, sometimes with blocks. And we're going to make the hips go like this. When this hip comes down this way, it seats properly in the joint and the ligaments stop being inflamed, and that's why the pain goes down. In addition, the pelvis starts to balance out and becomes more level, and so therefore the spine can sit on a pelvis that's more level and go straight up and down rather than tilt off to the side. So one of the key diagnostic features that we're going to ask you when you come in the office is, does it hurt on motion or does it make it better when you move? If it makes it better or makes it worse when you move, we know it's a musculoskeletal problem, as opposed to an organic problem, like let's say kidney disease or something like that. So that's one of the common questions we'll ask, and your answers will help determine how we're going to treat you. Okay, thanks for listening.